Business Unity South Africa is delighted that all adults in the country are eligible for COVID-19 vaccines. It says now that everything is in place. South Africans need to show up in their numbers and get vaccinated urgently in order to decrease the potential of a fourth wave over the festive season. The organization's CEO and co-convenor, Coovadia, joins me now from here in Johannesburg. Cass, thank you so much for joining us. What did you make of the decision from Cabinet that came through last night that they were going to open up the doors, as it were, of our vaccine sites to all adults in South Africa?
Business Unity South Africa, through our business platform that we established for COVID, Business for South Africa, we've been supporting government for quite some time on the vaccine rollout. And in our meeting with government in the last week or two, we had sort of indicated that it would be a good idea to open up vaccinations for everybody above the age of 18 and not to delay that any further. I think the fact that the government has opened it up, they were going to announce on the 1st of September, they've brought that forward. They've opened it up, and we've seen today a surge in vaccinations. People actually turning up. In the last week or two, there's been a bit of a lull. We have the capacity, we have the both public and private sector vaccination sites that are ready. We've indicated that even people who don't have medical aid can walk into a private sector site and be vaccinated. They'll be assisted to register. So we would urge all people, young and old, to go and vaccinate. We would ask young people to take their parents, their grandparents, their other relatives who may be older with them if people have not been vaccinated yet. And all the data shows that if you are vaccinated, the chance of your contracting COVID decreases significantly. The chance of your getting significantly ill and being hospitalized decreases significantly. And data begin to show that people who are getting sick and people who are being admitted to hospital are people who have not been vaccinated.
And indeed, that's a pattern we're seeing abroad as well, and they're a little bit further in their vaccine journey compared to where we are at the moment. Talk to me about this market or these age groups that we're dealing with now. We first had the 35 pluses. I was very relieved to be able to go for my first jab, and my second jab is coming up now before the end of the month. And now we've got the 18 pluses, as it were. This is a grouping or two groupings of people who are probably the most economically active. They make up a massive part of our workforce, but also the ones who are contributing to the economy, be it in the retail space, the manufacturing space as well. Talk to me about what kind of impact these vaccination numbers, if we do get it where we need it to be, could have on South Africa's economy.
Well, the impact would be very, very good, actually. We've always indicated that to roll out the vaccine and to get as many people vaccinated as possible is probably the single biggest issue for our country, both economically and from a human point of view. The human point of view is quite obvious why, but if we get as many people as possible vaccinated, we can get back to opening up the economy totally. We don't have to go into lockdowns again. Most people can get back to work provided we still maintain reasonable health protocols, the masking and social distancing and so on for a period of time for the foreseeable future. And I think to get people who of working age back into their jobs, people of working age traveling again so that it actually begins to have a positive impact on our tourism industry. Just getting the vaccine just opened up a whole lot of economic and social activities. So we can then start playing sports again, and people can start attending sports events. People can start traveling, certainly in the country for now. And as we vaccinate more and more people and we begin to break the back of this virus, international travel begins to open up. So the economic impact, both from the point of view that vaccinated people will be getting back to work and reducing drastically any possibilities of contracting the vaccine, but also enabling people to travel and do a lot of things that we haven't been able to do for the last 1.5 years will contribute to economic growth as well.
Before I let you go, Kaz, what is your advice to your members and indeed just businesses, business leaders, business owners in South Africa? Are you encouraging them to be more proactive in getting as much of their staff vaccinated as possible, like making it easy for them to do it, giving them the day off, perhaps providing transport and finding a site for them to go? And what is your advice in dealing with staff members who are practicing their right not to get vaccinated? I'm sure you have discussed that inside your organization as well.
Yeah, so we encouraging all businesses, and we in touch with businesses fairly often. We have webinars with CEOs and businesses all the time. We encouraging all businesses to make it as seamless as possible for their staff to get vaccinated, provide transport, give people some time off to get vaccinated. It's got to be in the interest of your business to do that. And most business people we speak to are responding very positively to that. I think, look, vaccines are not mandatory in our country, but I think that there will be certain types of businesses where staff are frontline staff, where they actually interact with other people, interact with customers. I think businesses will require their staff to vaccinate. And if they don't vaccinate, they might place them somewhere else in their business or so. But we have also reached an agreement at NEDLAC that businesses have the capacity and are capacitated to insist that their staff vaccinate, and if their staff do not show vaccination certificates, to actually encourage them to go and vaccinate. They don't have the power to dismiss staff or anything of that sort, but to encourage staff to vaccinate and to make it very clear that if you don't vaccinate, you might not be able to do the job you're doing, and you might have to be placed somewhere else. So I think that is happening, and we saw like Curo schools announced the other day that they would insist their staff be vaccinated. Legally, they can't fire their staff, but we would encourage all staff members. We would encourage every citizen in this country, actually above the age of 18, to get vaccinated. The anti-vaxxers and so on will remain, and they'll keep on talking about that. But all the data, all the science demonstrates that vaccinations work. Vaccines didn't just come up overnight. There are a lot of years of research goes into vaccines. We take vaccines for a lot of diseases very, very successfully. So please go and vaccinate. Let's not create a situation where there's dispute in the workplace. Let's not create a situation where, because you're not vaccinating, you actually infect others. So let's be responsible for your own health and for the health of others, and for growing our economy, protecting your jobs, and actually growing more jobs. Please vaccinate.
Okay, thank you so much. Coovadia is with Business Unity South Africa, is also the co-convener of Business for South Africa. We thank